Every second now around the world, someone with diabetes develops a diabetic foot ulcer, a wound. And that happens because they basically wear a hole in their foot, like we would wear a hole in a sock or a shoe. And every 20 seconds, someone has an amputation. And that problem is increasing in most of the world, not decreasing.
Diabetes is such a systemic and multifaceted disease that it takes more than one healthcare professional to take care of disease. It's too much to do and know. Knowledge is proliferating at such a level that it's impossible to keep up with everything. And so that's why you need a team and a group of specialists to take care of that.
The biggest thing we could do is to raise our voices together and tell patients, A, this is preventable, but B, if you already have a problem, come early and get to a comprehensive care group that can coordinate your care.
What ALPS's mission is to try to take all those wonderful people that are out there trying to do great work for limb preservation and link them all together via one resource. You go to this resource, you put in what your needs are, all those individuals that are looking for the same needs are there, and then we work together to match everybody together to be able to build limb preservation teams around the country.
That team concept has been shown over and over again in dozens of peer-reviewed papers now to have the biggest impact in limb loss prevention. The biggest impact, not some new tool, not some surgery I do, it's whether or not you have a functional team. ALPS is about how do I create that team, all with the end goal of having a better outcome for your patient.
For the patients who are at the highest risk, who are presenting to us with a wound and pre-existing conditions like diabetes and cardiovascular disease and possibly infection on top of all that, they need rapid, efficient, and aggressive care, and they need collaborative thinking and decision making. Because time is tissue, and as time goes on and patients are delayed in their treatment and the care gets fragmented and they bounce from office to office in a typical community pattern, ground may be lost in the leg, and the window of opportunity to save a functional foot can increasingly get threatened. Even the most experienced clinicians make better decisions when they're thinking together and when they're looking at the same patient at the same time.
Another key piece that's often missed is from the patient's perspective on how did they get to this point in the first place. There's this educational gap that we have to get over with patients and their current understanding of what it is that caused this problem and what we're asking them to do to treat it, and then how to prevent it from happening again.
It started because I stepped on a rusted nail. Within a couple of days, the pain I was receiving made me think it was neuropathy because of diabetes. I drove myself to the emergency and they said, are you diabetic? Yes. You have an infection and it's traveled to the side of your foot and we have to clean it out. And that's what caused the big gap in my foot. For me, it was just lack of education or the mentality, I'll get it later. I'll do it tomorrow.
My initial diagnosis was Charcot in the bottom of my heel on my right foot. I had to have minor surgery to remove a lot of that infection. Once that was removed, unfortunately, I had another infection that came along with that on the top part of the foot, which led to an amputation on my second toe. Biggest reason for the infection was the uncontrolled diabetes. After the first surgery, the healing process of it just wouldn't heal with the sugars being uncontrolled. They were talking about me possibly losing half my foot, and going through that, being told that, it was a really hard thing to swallow at the time. But I have to give a lot of the credit to the team. I amputated one toe, but it could have been worse. I could have lost my whole foot. So I'm really grateful that they put a lot of effort into making that happen.
I developed a callus on my foot, and probably like I've done a million times before, I went to peel it off. I guess being diabetic, that wasn't the thing to do this time. The next day, my foot was gangrene on my big toe and the next toe. I kind of already knew or had in my head that I might lose a couple of toes. I never thought that I would lose all 5, but that's what happened. There's so many people that I talk with and deal with on a daily basis that have no idea if they're diabetic, and most of the time toe removal is preventable.
You couldn't create a more silent and sinister sort of syndrome, to be alliterative. people don't drop dead on the streets from this problem. It happens quietly, and that's what's so sinister.
In addition to providing provider resources, the hope and mission of ALPS is to provide better resources for patients. Patients and their families really suffer through the process. You know, as physicians, sometimes we're not always the best of sitting down with patients, talking to them about the process. And so I think the hope through ALPS is, you know, to have this robust sort of resource for physicians, but also to be there for the patients, because ultimately those two go hand in hand.
Knowledge, I think, is key, not only for physicians, but also for patients, and creating that health literacy so they can become their own advocates and to share that information with their friends and family. And so I do believe that we as physicians, because we bear witness to the result of that, that it is our obligation to advocate for these populations, to fight for these populations. But if we ever move the needle on diabetic amputation rates, that means that we have affected everything upstream from there. Hopefully we've changed the environment and community to one of health and happiness and joyful living.
We're really being cognizant of is taking in the patient perception and trying to come up with new solutions, again, that's not just gonna fix the hole in their foot, but really help the whole patient to benefit. And so that's certainly a challenge, but I think one we're definitely pursuing very vigorously.
We can eliminate preventable amputations over the next generation. And I say we because it's we. It's not I, it's not you, it's we. And bringing that together with the patient at the center is what ALPS is all about.